Premier Kathleen Wynne unveiled a 3-year plan this morning. She hopes to curb sexual assault in the province, and it all started with this public service announcement.
Thanks for not telling my girlfriend.
Say that to me.
Hi.
Thanks for not telling anyone.
When you do nothing, you're helping him. But when you do something, you help her.
Thanks for telling the bartender. Thanks for stopping him.
Males are often cast as the bad guys, but that's not always the case. Oakville resident Sean Caffrey has donated a free renovation towards Halton Women's Place worth $15,000.
Our facilities are often at capacity or over capacity for most of the year. Halton is known as an affluent community, and therefore people are surprised about that. But the fact of the matter is that, like I said, we are at full or near full most of the time of the year. And so we know that women abuse still happens in our community. It happens in all communities. And we need to make more people aware that we're here, that there's options, and that there's a safe place for them to go to.
Thanks for keeping your mouth shut.
The PSA also touches on the workplace. They're not all connected, but sexual assault can lead to mental health issues. MPP Eleanor McMahon hosted Minister of Labour Kevin Flynn this afternoon for a roundtable discussion regarding workplace mental health focus for the Burlington business community. And she says it's all a vicious circle. They need to be proactive, not just reactive.
If you have addictions issues, quite often it's related to mental illness. If you have mental illness, quite often you seek to cope by addictive behavior. So the money in our LIN is going to address some of these very important frontline needs, and we're going to begin to see that funding actualized immediately, and that's $2 million into our surrounding community, and it's money that people in Burlington can access.
LIN meaning Local Health Integration Network, covering Hamilton, Niagara, Haldimand, Brant, and Burlington. They've broken down their $2 million funding into 4 sections, one of which is a mobile outreach team.
Early intervention and a focus on youth and the transition between youth and adult. That's a time when very often issues related to mental health and substance abuse are coming to the fore in that 17 to 24 age group, and if we can nab things at that point, that will make a huge difference.
The annual cost of mental illness and addictions cost the province $40 billion. So the next step is the Ontario Comprehensive Mental Health and Addiction Strategy, where they plan to give $138 million over 3 years to local agencies who can work with this proactive plan, not just a reactive one.
Thanks for telling HR.
For Halton Insider, I'm Krista Sharpe.